Okay, this is Dr. Bernstein, Jay Bernstein. I'd like to talk to you about garlic, the scientific evidence that it's has significant health benefit. First thing I want to talk about is oxidative stress. The fact that many different, if not most, of diseases, especially chronic diseases, um, have an underlying pathophysiology involving oxidative stress. Um, from all kinds of different brain chronic diseases to lung disease to heart disease, arthritis, renal failure, um, inflammatory bowel disease, cancers, diabetes, and susceptibility to infection. Oxidative stress is caused by these molecules in our body called reactive oxygen species, and these are intracellular uh, molecules that cause damage to the cells. And this is just this on the left. This is from a paper describing the pathophysiology of how certain conditions related to decreased sperm, decreased fertility, involves oxidative stress. This is from the picture on the right involves the mechanics of how reactive oxygen species um, results from hyperglycemia, and other elevated blood glucose when people have diabetes, and then this then goes on and causes more problems in the DNA, in the proteins, in the cells, and outside the cells, as well as affecting the lipids and the cell membranes, and then this then further worsens the pancreas, the insulin in the pancreas, and then that actually worsens the hypoglycemia and causes all kinds of problems such as kidney failure, renal blindness, and diabetic retinopathy, and diabetic neuropathy, which is the neurologic problems people get from diabetes, as well as heart disease. This is just another example from the literature showing that reactive oxygen species (ROS) involved in neurodegeneration and cardiac hypertrophy, which is an enlarged heart, kidney problems. Here, this is all just sort of the pathophysiology worked out, biochemistry of all these different mechanisms, and this is also for liver failure. Really, it goes. You can really apply it to any organ, pretty much. And these are examples of the reactive oxygen species in our body that cause problems: superoxide, hydroxyl radical, hydrogen peroxide, singlet oxygen. And certainly, there's a big question whether or not hyperbaric oxygen, which is a big topic right now amongst people who are promoting health, and it's certainly good for absolutely good for underwater injuries, high altitude injuries, no question about that. Chronic wounds, it's used. The evidence is pretty weak. There's really not much evidence for other uses. Most of the uses that people are using it for, but the theory is that could be also promoting reactive oxygen species. The cellular injury that's caused by a reactive oxygen species. The question we want to sort of think about here is that whether or not this damage results in weakening the immune system, so you'd be more susceptible to infections. Also, the cancer, which is, when I say oncogenic, means it promotes cancer. Can the cells that it not normally are sort of regulated, whether they're dividing too much, which can be eventually lead to cancer, stopping them, versus also the opposite, which is cell death. So, how do we understand that our body needs to sort of correct these things, these reactive oxygen species? And the way it works is that there's the opposite, or I should say, the neutralizer of the reactive oxygen species is glutathione in our body. That's the most common molecule we have in our body, which is a combination of 3 different amino acids, which is glycine, glutamine, and cysteine. So it's very rich in sulfur. We call it reactive sulfur species. So reactive sulfur species neutralizes reactive oxygen species, and glutathione is the most abundant one, the most abundant RSS. And RSS are the natural antioxidants we have, and that neutralizes cellular repair. If we can induce or increase RSS to repair, that means we can theoretically improve our ability to fight infection as well as decrease cancer. And this picture is from an article showing that it's really a balance between antioxidants and oxidants. So in other words, this is the ROS, this is the RSS, and if the antioxidant, the RSS, is less than the ROS, you get disease. And then over here, where you have the antioxidant, which is the RSS, the reactive sulfur species, it can counterbalance the ROS, and that's when we can have healing. This is taken from an article published in the American Heart Association website, basically showing you that the fundamental feature of the molecule of the RSS or glutathione, there are other ones as well, but is this sulfur hydrogen molecule that basically does a bunch of things that helps heal heart damage. This is on the right. So this is from an experiment where they took blood vessels and they ligated the blood vessel and watched how it heals. And at the other side of this blood vessel where they sort of squished it down here, there was normal repair of this blood vessel, because this thing called CSE, which is an enzyme that produces the reactive sulfur species, is working normally, and there you get monocyte recruitment, and eventually you correct the problem here. When you don't have this, when this is knocked out, CSE is knocked out, so you don't have the reactive sulfur species you need. When you do this, on the other side of it starts to balloon out, and that's not a normal repair mechanism. And also down here inside the blood vessel, you have this is all working normally. The CSE causing normal sulfur contribution to the repair. It turns out to be normal, and then here it'll be abnormal, with a turbulent flow, which can lead to problems. And here the cell-cell interaction, which is bound by these microtubules, is also moderated by this CSE, which is ultimately the reactive sulfur species. So if you don't have that, the cell-cell connections are compromised. So this is this GSH, which is glutathione, inside the cell and inside the mitochondria. It's really a balance between this and these two things. Inside the cell, these molecules. This is a GSSG. This is called a redox. In other words, this is this GSH will combine with this reactive oxygen species here and reduce it, which is now a safe molecule, not going to harm the cell, and then but it itself becomes oxidized. And so the ratio between this and this, like 100 to 1, means it's a healthy cell. If the ratio is like 10 to 1 or less, it's a very unhealthy cell and very unlikely to perform its function normally. Also, the same kind of mechanism can happen when this glutathione is attached to a protein as well. And then it gets recycled back to the original glutathione. This is another picture from another article showing the relationship between GSH and GSSG. It's innervated by these two enzymes, the glutathione peroxidase, glutathione reductase, and ultimately the glutathione here, when it's doing its job, it's going to the mitochondria, the nucleus, the endoplasmic reticulum. These are the organelles within the cell that need repair, and that's the GSS comes to the rescue. And also it can, as well, it can go outside the cell too, like here, and cause some repair outside the cell as well. So GSH, glutathione, is very important. This is from an article showing that the white blood cells that fight infection, if there's a low GSH to GSSG ratio, like I said, less than 100 to 1 or close to 10 to 1 would be really bad. These communicating cytokines are not they're not being released adequately. That decreases the migration of the neutrophil. You want neutrophils, which is the white blood cells fights like bacteria. You want that to migrate to where it needs to go, and if it doesn't have these cytokines, it's not going to migrate normally, and that's because of a low GSH. GSH, again, low GSH to GSSG. In a macrophage, means that the macrophage is not going to be doing its job, which is engulfing these foreign particles, because it needs to communicate with this natural killer cell, and if it doesn't communicate well, because it doesn't have the cytokine interaction, normally it has a low ability to kill the foreign antigens that they need to. So glutathione is very important. This is from an article published in 2024 showing that all the evidence for using nebulized, which is like people use a nebulizer for like asthma, but you're breathing in this liquid that turns into a vapor, and then you're breathing in, goes into the brain, and so the glutathione that's in this nebulizer, if you breathe it in, this is the glutathione, it attaches to the ROS, the reactive oxygen species, and it can then basically scavenge the more ROSs to reduce neuroinflammation in the brain. It helps protect the brain, repair damaged brain cells, and improve the impulse of the nerve cells. This is a graph showing that there's many different ways in which glutathione, GSH, can protect the inner workings of the mitochondria, which is an organelle within the cell, very important. This is from an article showing you basically the mechanism of how we cure a Tylenol overdose. Normally, when you have Tylenol and you metabolize it, this is Tylenol here, it produces this molecule, which then is broken down to by glutathione. When you have too much Tylenol, you have a Tylenol overdose. So for example, like say 10 grams for a 70 kilogram person or more, roughly, you can exceed the ability to break this down. So in other words, what happens is you run out of glutathione. When you run out of glutathione, this NAPQI builds up, causes cell death, shuts down your liver, and people can die that way from liver failure, which takes weeks or months. It's a miserable death. But within 8 hours, if we give this antidote called N-acetylcysteine, we can replenish the glutathione, and then the person can live. And there's a pretty close to 100% cure rate. So by giving a medication that improves your glutathione, it's pretty powerful. We can cure Tylenol overdose. This is from an article showing that the oncologists are now giving, let me go back, they're giving glutathione for the basically chemotherapy, all the toxicities from chemotherapy and the reasons why. Basically when you have inability to make glutathione, you have low glutathione, you have high toxicity. When you have normal or high glutathione from these enzymes working properly, then you're able to decrease or minimize the complications of chemotherapy and cancer. And yeah, pretty interesting here. This is from an article showing us that low glutathione is associated with these viral infections, severe viral infections. You have HIV, influenza, rhinovirus, which is like cold virus, hepatitis, and herpes simplex virus. And when glutathione is given by supplement, you can actually improve the ability to eradicate these viruses more efficiently, more quickly. And ultimately, you can, because the viruses produce the reactive oxygen species that does its damage in the body, that depletes your glutathione, causes problems, and causes low pH, oxidation. And then you can give glutathione, and you can break that cycle. This is an article published theorizing why some of the patients who got COVID had bad outcomes, whether it's morbidity or death. They hypothesized in this article it's related to glutathione because of all these other conditions that were shown to have decreased glutathione, chronic diseases, diabetes, cardiovascular disease, respiratory disease, liver disease, et cetera. And these are risk factors for COVID, morbidity, mortality. Age is also a big one. Glutathione decreases with age, which is what this article shows. This is an article showing, among a number of things. Let's just focus on this one, that the glutathione decreases with age, as we see here. This is what this schematic view of what this article is describing in the content of the article. This article was showing us that there's different ways to improve your glutathione. We can increase it by just synthesizing it de novo. You can synthesize it from generating from GSSG, remember that redox. And then we can also actually enhance our glutathione through nutrition. And this article shows you that there's a lot of different evidence. All these numbers are just resources. These are the references this article lists and describes in the article, in the content of the article, show all the evidence for various nutritional, whether it's supplements or diet influences on glutathione levels. Therefore, would be able to control cancer cells. And this is an article showing that garlic actually has been shown to increase glutathione. Over 24 hours, if you give one dose of 15 micromoles of allicin, which is a component within garlic, you can increase your glutathione level up to from here to here. It's got a dose response. In other words, it goes up each dose, and sorry, not each dose, but it goes up. It goes up each time period. You're seeing it go up and up and up, and then it goes down, and then about say 48 hours, it's time for another dose. You can bring it back up. So this graph over here will show us that every 48 hours. In other words, you get to about right here, and then you take another dose. So this is taking a dose of allicin every other day in these exercises. This is from a cell culture that you can sustain the levels. The black is the level of the glutathione when you give an allicin every other day to these cells. So you can sustain the levels up to 10 days. Let me just see this here. Okay. I wanted to add one more thing in this. There's an article. This article in particular also shows that if a person takes 2 grams of garlic, which is 2 to 3 cloves, every day for 7 days, you can increase your glutathione. You can increase your actually, you know what? I'm sort of confusing with the next benefit we're going to talk about. Actually, we'll talk about that. This is an article that was really the earliest article I could find in the literature showing that the properties of garlic being antibacterial. It describes what it does is that it goes through this exercise where it uses the same assay, the same test used for penicillin in 1944 to show that penicillin was antibacterial. It used the same test with garlic, and it showed equal effect against bacteria. Interestingly, in the same article up here, I circled that this is a drug that was synthesized in a lab called DES, diethylstilbestrol. Happened to be they got a patent on this, and it was marketed for women to prevent miscarriages. And as it turns out, it never really worked for miscarriages, but it was prescribed for a couple of decades at least, or more, maybe 25 years. And eventually was found to cause cancer, many different types of cancers, including vaginal cancer in the daughters of the woman who took DES. So it's not on the market anymore. But they obviously got a patent for this. But garlic, there was no patent because it's natural, so it never really took off. But so that was interesting. This is an article showing, really just summarizing other articles in the literature looking at the antibacterial properties for each one of these bacteria. For when you add allicin to these to various systems of bacterial growth, and the A is like the most effect, but the bottom line, they had effect in pretty much all of these different studies showing antibacterial for gram positives and gram negatives. This is the chemical reaction that occurs in garlic when you have a piece of garlic and you chew it or crush it. What happens is this: the allicin is in one compartment in the garlic, allinase, which is the enzyme, in a different compartment. You mix them together by chewing it or crushing it. You get this molecule here. Then 2 of these same molecules, the same thing here, 2 of them together. There's a chemical reaction that basically, and it's called, it takes away water, and you get this thing called allicin. Allicin has some increases the glutathione. It also has other antibacterial properties, and it has. Then we'll see that this other properties in a minute. But once you have that molecule allicin, it can turn into 13 more molecules. If you notice, all these molecules have sulfur. Sulfur, again, these are all reactive sulfur species, okay? Because it's sulfur hydrogen. because when it doesn't, you don't see anything else on it. It says any remaining electrons will be bound to hydrogen. It's just sort of assumed in the chemical formula. In any case, there's 13 molecules here that are very active in our body that improve glutathione, and as we'll find out next, the next slide after this, there's an additional benefit. So I just want to just remind you of the benefit that, this allicin increases glutathione. But here's another article I want to show you, which is very, very important, because this molecule interferon, INF alpha, is extremely potent, extremely useful to fight infection. It's a natural cytokine we have in our body, a natural compound that cells release to fight infection. It's very powerful. It can cure hepatitis C, hepatitis B. It's used for treatment many chronic illnesses. It's used for malignant cancers that fail chemotherapy. For example, it's FDA approved to treat malignant melanoma after a person fails chemotherapy. But there's no studies looking at it to treat cancer de novo, because you can't withhold standard therapy. So we don't know how that would work out. But after the chemotherapy fails, interferon comes in and helps the patient dramatically. So this dotted line basically is the level of interferon going up when this group of people were eating garlic. So it goes in 4 hours, you go from 5 to 50 in your interferon levels. And interferon is a very expensive drug. And but by the way, it's always more effective when it's naturally in your body. Okay, so we can increase our interferon naturally by eating garlic, much more effective than if I give interferon as a drug externally, exogenously. That means that it's given as a drug, and it's never as effective as a natural hormone. So, and this graphic here shows that in 2 days you can maximize the benefit given 2 grams, which is 2 to 3 cloves of garlic, and it goes up to from 10 to 25. And this study also shows that if you take 2 grams a day for 7 days, once a day for 7 days, your interferon level goes from 9 point something to 45, over 4.5 times in 1 week. Take it every day. You probably don't have to take it every day. You can take it every other day. As you see, in 2 days, you can match the maximum effect. And the glutathione, you just have to take it for the benefits of glutathione. You could take it every other day as well, as we learned. And this shows you basically the how many grams. 2 grams is 2 to 3 cloves. So you really get near maximum benefit of the 2 cloves. You can take 4 cloves, get a little bit more benefit, but there's you increase your interferon. This is just after one after one dose of garlic. Yeah. Okay. This chart shows you in volunteers and when people eat garlic versus not eating garlic. This is in cell culture here, where they basically, the ones that eat garlic for a week, they have a higher level of interferon alpha compared to the ones that didn't. And then in the cell culture, you add the garlic extract to the cells in the petri dish, and you get higher interferon versus without having garlic added to the cell culture. And then this L name is basically blocks this chemical reaction. This is sort of the control. You'd expect that to be 0. This is just a slide showing that when you have these antibiotics, like say penicillin or gentamicin or levaquin or ciprofloxacin, these types of antibiotics, if they get resistant, the way it works is that they can overexpress cysteine, and then they can overcome the effect of the antibiotic. Is why the antibiotic in these particular antibiotics work in various mechanisms, but ultimately they create a reactive oxygen species inside the bacteria. That's how it kills the bacteria. But the bacteria can resist against the antibiotic by overexpressing cysteine, and that helps it become resistant to the antibiotic, which would not be a problem with garlic, because actually garlic would garlic would be enhanced, basically doing the same thing as cysteine, basically. So it works by a different mechanism. So ultimately, my just want to just kind of go over this real quick. Oxidative stress is caused by reactive oxygen species. We have our natural reactive sulfur species, which can be enhanced by taking garlic and basically and so it can increase glutathione. And most likely it works separately in addition to glutathione as well because it's its own sulfur molecules. It has these allicin metabolites also have antibacterial properties. They can be anti-oncogenic, in other words, decrease the problems with cancer. It can be antibacterial, antiviral, and my recommendation to eat more garlic.